Well, hi everyone. Welcome to the second video in our 6-part series on inflammation. In this video, we are interviewing Dr. Jaffe, the founder of the Lymphocyte Response Assay test, and we're describing the importance of accuracy in delayed onset sensitivity testing. Typically, the delayed onset sensitivity testing is done with what's called IgG, immunoglobulin G, and we found that this just wasn't accurate enough to help people with swelling and pain. Our patients weren't responding. So what has worked wonderful for us is Dr. Jaffe's testing, because it measures the activation of T lymphocytes. Now, T lymphocytes only activate when there's a harmful reaction. So by only testing the T lymphocytes, we get the accuracy we want and we can identify these inflammatory triggers. So please watch with me. This is a great video, lots of good information.
In essence, develop a fingerprint of the immune responses. So an item might be generally good for a person, but might specifically be bad for a person. And we can tell you to distinguish good from bad, and then we can give you a detailed roadmap of how to recover from whatever inflammation, whatever repair deficit, whatever autoimmunity, whatever cardiovascular risks might be present. So we assume that this is a novel approach.
Yeah.
Even though we've been doing it for 40 years, it's still novel. Cell culture is just beginning to come into clinical use. It's being used in transplantation, and we use it, of course, for health promotion. So any questions you have about the details of the assay, I'd be happy to address, because this is different. This is not a serum test. This is not just an antibody test, because if you just measure antibodies, you'll get confused. If you do a true cell culture, an ex vivo cell culture, you'll be enlightened.
So the enzyme activation on the wall of the T lymphocytes, that gives the harmful versus the helpful responses with immune system.
Basically, yes. So we made an assumption that has proven to be true, which is that there's a kinase that is turned off when the cell is resting and turns on immediately upon the recognition of a foreign substance as an antigen or something foreign. Yeah, kinase. A kinase means we add phosphate to different molecules. So a number of things happen because of this kinase. For example, if you wait 3 days, you'll get a colony of cells begin to form. If you use radioactive isotopes, you can show the incorporation into new DNA. So this kinase turns on the nucleus to proliferate, but it also turns on the cell to be alert to what's outside. So actually, the kinase phosphorylates a glycoprotein on the surface of the lymphocyte, and we pick that up as what we call the halo around the cell when the cell is activated, when its glycocalyx has basically pushed everything away because it's now metabolically turning on in order to proliferate.
And a helpful immune response wouldn't do this.
No. That's right. So yes, this is true of the T cells. Yes, this is true for immune complexes, but this is especially true because lymphocytes respond to harmful complement-fixing antibodies. They don't respond to neutralizing beneficial antibodies.
Great.
So this is using physiology and biology to detect a functional difference that the cell tells us and we report.
Great. That's the explanation I was looking for. That's perfect. Well, that was a lot of information. Feel free to rewatch it. You can call us if you have any questions, and also our website has additional information. The next video in our 6-part series is going to describe how these activated white blood cells lead to problems. There's a cascade of events that happens why there's specific areas of our bodies that swell and have pain. So stay tuned for that one. It's going to be a great video. Thanks for watching.